right here on Justice last week, the benefits of therapeutic intervention for COVID. Now, take a listen to what Bill Gates had to say this week.
You can see the therapeutic benefit faster than the protective benefit. So I think there's a good chance we'll have substantial death rate reduction by the end of the year with the combination of those new tools.
Dr. Robert Hariri is the founder and CEO of Cellularity, a spin-off of biotech giant Celgene. He joins me to continue this important conversation. And Doctor, thanks for being with us. And I never thought that I would hear Bill Gates actually talk about a vaccine and, in fact, a therapeutic when we had just talked about it last week. I mean, what do you think? What is going on that Bill Gates, is he, changing horses here? What's going on?
So, Judge, it's encouraging that that Bill Gates has taken it upon himself to recognize that today, even though in a perfect world, having a vaccine to help control this outbreak and prevent the spread of COVID-19 would make everyone's life easier, the reality is people are sick today. And we need effective ways to manage these patients. And in fact, in the last 6 months, we've learned quite a bit about how to manage the severe complications of COVID-19. And many of those methods of treatment are extensions of how we treat patients with cancer and other serious diseases. So what we're really beginning to focus on today is that, as optimistic as we can be about the great work that's going on, and Dr. Navarro described some of the efforts to put large numbers of vaccines in the hands of public health officials, you have to remember, a vaccine is not a clinical tool. It is a public health tool. What I mean by that is when a patient comes to a hospital and gets admitted for a disease, doctors don't vaccinate them. Vaccinations are administered by physicians, nurses, or public health officials to protect a community from the outbreak of an infectious illness. What we have to be concerned about is when patients do get sick, how do we manage that disease and how do we keep them from dying? And that comes into the hands of those people who develop treatments, therapeutics.
Okay, and so when you say treatment therapeutics, you can, I assume you mean you say immunological or IV or pills, or what are we talking about? Plasma?
That's right. So I'm talking about the things that we commonly see doctors use: drugs, immunologic tools like infusible immune products, sometimes cellular therapies, sometimes things like convalescent plasma that Dr. Navarro has alluded to before. These are all treatment tools that can be administered to patients who are actively ill. Unlike vaccines, their application can be very focused on people who actually become ill and require hospitalization, whereas a vaccine will be administered broadly to the entire community without necessarily discriminating between those who are at risk for developing the disease and those who might in fact get it and not have the serious side effects or complications that require hospitalization.
Doctor, are we making the right bets to find the medical solution for COVID-19? I mean, you hear about all the money that's going into the vaccine. I mean, how do you balance this?
Well, I think early on, the focus and the great investment in developing strategies to develop vaccines helped to energize the industry to create several horses in the race to meet this need. But the truth is that we're recognizing that an equal, if not balanced approach, where a similar investment can be made in novel therapies as well as retasking therapies, makes a lot of sense as well. Remember, doctors treating COVID patients who develop the serious complications are relying on tools, many of which were developed for other diseases, things like cancer.
Right.
The bottom line here is that when you can actually create a great deal of confidence in the community by showing that we can take patients who develop the complications and keep them alive, discharge them from the hospital, and allow them to recover. And that's the job of those who develop treatments. And we think that greater investment, because up until now, over 80% of the money being invested in these new approaches have been directed at vaccines, not new treatments.
Okay. All right. Dr. Robert Hariri, always good to have you on Justice. Thanks so much.
Thank you.
And calls to defund the police have so many in America outraged, including former NFL running back Herschel Walker, who joins Justice Live in a moment.